Okay, we're live. Hi, guys. Hello, everyone. If you're watching me right now, please type 5 in the comment section. Give me a high five. Type 5 in the comment section. Guys, type 5 in the comment section. If you're watching me, give me 5, give me 5, give me 5. Type 5. If you're watching me right now, please type 5 in the comment section. Yes, Creeper. Wow, Creeper, it's nice to see you. Creeper already sat the exam past, but you missed Micah and Bhavna, so you come to say hello. Creeper,
Thank you, Kripa.
I hope you're doing well, Creeper. It's really good to see you. Fantastic. Guys, type 5 in the comment section. Type 5. We're going to make a start straight away. So you type 5 in the comment section for me. If you haven't done so already, type 5 in the comment section. It lets me know everything is working. Type 5 in the comment section so we can make a start. Also, I need you to share this link. If you haven't done so already, please share this link to a friend. If you know anyone who's sitting the GPHC exam, anybody who is preparing to sit the assessment this year, just share the link, send the link to them to get them to join us. Yes, share the link to invite anybody you would like to invite. If you're on a WhatsApp group with friends, if you're on a Telegram group, Facebook, Instagram, TikTok, you can literally send this to invite somebody or send this to invite friends or colleagues to join. Yeah. Okay. Last question before we start. I just wanted to ask. So earlier this afternoon, I gave the link to today's session to some pharmacists colleagues, right? So I just wanted to find out if anybody got this link from a pharmacist at their workplace or a pharmacist who is their supervisor, for example. Please type 10 in the comment section. If you got this link, I'm just doing a quick poll. Type 10 if you got this link from your supervisor or from a pharmacist you're working with today. Anyone? I just want to have an idea. If you got the link, just type 10 because earlier today I gave it to some pharmacists. I just wanted to see if anyone came through from that particular endeavor. Type 10 if a pharmacist at your workplace gave you the link for today's session. Type 10. Okay. All right then. So a few people. All right. Okay. So let's make a start then, shall we? Guys, as you know, my name is Micah. I'm the lead pharmacist here at the London Pharmacist Network. And today we have two beautiful, amazing ladies joining us. They're also newly qualified pharmacists. We have Bhavna and we also have Jazz. Yes.
Hi, guys.
I would like Bhavna and Jazz to just introduce you. Just say hello. Before we get started properly, I'll go to you, Bhavna, first. Bhavna, say hello, and then we'll go to
Hi.
Jazz.
Hi, everyone. My name is Bhavna, and I qualified in June 2025.
Fantastic. So Bhavna qualified last year, and that was in June. Let's go to Jazz.
Hi everyone, hope everyone's well. So like I said, my name is Jazz and I qualified January. I was on the register January 1st. Yeah.
Fantastic. So Jazz, Jazz, I'm not sure if your audio can be increased a little bit. Just struggling to hear you. I'm not sure if there's anything you can do the volume. But yeah, so Jazz passed the exam in the November sitting, and she's gone on the register since January this year. So who better to give you advice than people that have just gone through this journey fresh? Yes, gone through. Hopefully, Bhavna and Jazz still remember all their revision key points. Hope they still remember all the mnemonics. Tramadol hates me. I'm not sure. you probably hate Tramadol at this point because you've dispensed so many. You probably don't like Tramadol at this point.
No.
But, yes.
Funny enough, I was thinking today. I was looking at something, and I had all 4 drugs which increases serotonin syndrome. And in my head, I was trying to remember serotonin. What did that stand for?
Yeah. Oh, fantastic. Okay. So, so guys, today we're going to go over a number of things to support you. It's a session to give you advice. You can also ask questions. Yes, you can also ask questions. Like I said, in today's session, you get a chance to hear from Bhavna, who is a newly qualified pharmacist, sat the exam in June last year. I know a lot of you are going to be sitting the exam in June. And also we have Jasmine, who sat the exam well, actually, Jasmine sat both exams, and she's spoken about this on her TikTok page. And it's good to speak to somebody like Jasmine, because then she can tell you, what she did differently, what she saw in June versus November, that type of thing, So we're going to smash today's session as always. Tell us which uni you went to, if you don't mind. Type in the comment section, which uni did you attend for your MPharm or your OSPAP course? Which uni did you go to? Did you go to Brighton? Did you go to Hertfordshire, Sunderland, Manchester? Tell us in the comment section if you're watching right now. It'd be interesting to see. Which uni did you attend for your OSPAP or your MPharm? Tell us. Yes, we'll get Jasmine to share her TikTok handle as well. Yeah, tell us, which uni did you go to? Which uni? Tell us. Wow, loads of Brighton in the house. Hertfordshire in the house. Fantastic. Which uni did you attend? Huddersfield. Wait. Jasmine, you went to Huddersfield, didn't you?
I did, but I've seen that one of my friends has just commented that they were also at Huddersfield with me.
Yes.
So pick up Huddersfield.
Yes. Woo. We have Sunderland in the building. We have Bradford in the building. There's loads of different units here, which is fantastic. Newcastle, wow. Okay, so guys, let's make a start with discussing, your outcomes for this year, okay? And you can write these things down, or you can come back and watch this later on, okay? If you want to ask us any questions live, then you have to stay live and be able to ask questions, if you would like to ask questions. So let's go over what your outcomes are for this year and some of the important things that you need to get out of this year. So as you know, the GPHC exam will be happening in June, but I know for a lot of you, you're going to be in your training till July. Yes. And this is the first year where we have loads of trainee pharmacists who are going to be getting their IP qualification at the end of the year as well. So, this is fairly new, not just for yourself, but for everybody. And everyone has to make that adjustment. But yes, so one of the things you want to get out of your training year, your foundation training year, is what we call personal and professional development. Now, the thing about this is it may vary depending on where you've done your training. And because as you know, some pharmacies are very busy, some pharmacies are quieter, some people are in hospitals, some people are in community, and so on and so forth. And so when it comes to your personal and professional development, I want you to take this seriously, because when you become a pharmacist, which for a lot of you will be in a few months' time, you're going to be that person that people are going to be coming to ask for advice. You're going to be coming to ask for directions, and so on and so forth. So don't think you'll be a trainee forever. I'm sure a lot of you can't wait to actually finish the training year, but I want you to take your personal and professional development seriously as you're doing that. So what do we mean by personal and professional development? Okay, so one of the things you need to do whilst you're doing your training is to ensure you engage actively at your training site. Yeah, so don't think you'll be a trainee forever, where anytime there's a question, they ask the pharmacist, or they ask the locum, or they ask the manager. That will be you in a few months' time. So are you actively learning at your training site? Are you asking questions at your training site? Even with the pharmacy first services, for example, when the pharmacy first services are being offered in your pharmacy, are you getting involved, shadowing the pharmacist to see? I literally speak to so many people who say they've never seen how an otoscope is used before. They've never looked down a patient's throat before. They've never done any of all these things. And so how are you going to perform as a pharmacist if you're not involved in the day-to-day work that goes on in pharmacy, whether you're in community or hospital or GP surgery? So please, it's not too late. Try and make that effort. Ask questions, engage. It will be you in 4 months' time that will be making all these decisions. So try and engage as much as possible. The next thing is your supply medicines. Yes, we want to be confident when it comes to supplying medicines. And one of the things that are important when it comes to supplying medicines is to watch out for drug interactions. Watch out for drug interactions. Now, the way it actually happens in real life is that the dispensers do a lot of, just dispensing in most pharmacies, and then they pass the prescription and the medicine to the pharmacist, and the pharmacist has to do the final check and then hand over to the patient. Not everywhere, but in a lot of places, this is the system they have going on, right? So you want to be able to spot things quite quickly. One of the things you want to be able to spot are doses for children. And so anytime you see a prescription for a child, so anybody who is, we normally do under 12, the places I've worked in, especially Tesco's, they normally make us highlight for children under 12. Why? Because as we know, these sort of patients, their organs are still developing, their kidneys, their liver, things like this. So anytime you see a prescription for a child, you want to highlight, get a highlighter, literally highlight the age of that patient, meaning you're reminding yourself to double check the doses, whether it's antibiotics, for example, or oral solutions, oral suspensions, topiramate. It doesn't really matter what it is. Make sure you're double checking for children and also for elderly patients. These are high risk patients. They're high risk patients. And you can also do that whilst you are working right now. As you're working as a trainee pharmacist, get involved in some of these things. If you see a dose, you're not sure, double check the BNF. It's online. Literally, you can just go online and have a quick look. Yes, make sure you're looking at doses for children, doses for elderly patients, or anything that seems abnormal to you. Make sure you're checking. Another thing is drug interactions. Okay, so in community pharmacy, there are 5 common drug interactions that we must know, and you want to start looking at those things not just when you qualify, but from now, because they will help you in your GPHC assessment, and they will also, that type of information will also help you when you eventually become a registered pharmacist. Okay, so what are the 5 top drug interactions that we want to always watch out for in community pharmacy? Tell us in the comment section if you know any. Number 1 will be statins and macrolides. Statins and macrolides. So what do you think will happen if we took statins and macrolides together? Literally, there was a case in Wales where a woman passed away because she was given 2 courses of macrolides. I think it was clarithromycin, and she was also on long-term statin. Apparently, she wasn't told to stop taking the statins whilst on clarithromycin. She had 2 courses and she ended up dying. Obviously, a lot of these patients will be elderly, old, frail patients. So always watch out. Even if they're coming to your pharmacy for the first time, ask the patient, do you take statins? Do you take this? And if you do, make sure you stop those statins whilst you are on the macrolide, clarithromycin, erythromycin. Yes? Very good. The next one is clopidogrel and omeprazole. Clopidogrel, you'll be so shocked the number of cases of clopidogrel and omeprazole that we still see in real life. What is the problem with this? The problem is omeprazole reduces the antiplatelet effect of clopidogrel, meaning your patient is going to be exposed to increased risk of blood clots, increased risk of stroke. Okay, so anytime you see something like this, you need to flag it up and get in touch with the prescriber. They need to change omeprazole to something like lansoprazole. Okay, so even as you're doing your training, you're watching out for things like this. Don't wait, because it will become a habit once you start watching out for these type of things before you actually become a registered pharmacist. We also have so many cases of simvastatin over 20 milligrams and amlodipine, and amlodipine. So watch out for that one as well. You still see so many cases of amlodipine and simvastatin over 20 mg. Risk of rhabdomyolysis. Watch out for these drug interactions. Now, watch out for these drug interactions when you become a newly qualified pharmacist. The 4th one will be azoles and warfarin. I told you the story of how a lady died in East London because she had courses of fluconazole while she was on warfarin. The person who prescribed the fluconazole is different to the prescriber for the warfarin, but it wasn't checked. She ended up taking fluconazole and warfarin and suffered from internal bleeding. She passed away in East London. Yeah. So we're looking out for azos, quite frankly, azos and warfarin. Azos and warfarin. Azos and warfarin. Very important. And the last one I'm going to say is SSRIs and NSAIDs. So many cases of SSRIs and NSAIDs being taken together without a PPI. What is the problem with SSRIs and NSAIDs? Increased risk of what? Tell us in the comment section. So as you know, so many of our patients here in the UK are on antidepressants. Yeah. So many patients are taking citalopram, fluoxetine, paroxetine, escitalopram. Loads of people are taking antidepressants. They may be taking citalopram for things like panic disorder, for example. Some people are taking SSRIs for bulimia and so on. But then they buy ibuprofen over the counter. Yeah, and they take both of those together. What happens? GI irritation and bleeding. Some of them are on naproxen, some of them are on diclofenac. They're taking SSRIs with these things and they're bleeding internally. Some of them don't even know it, you see. So I'm sure there are so many drug interactions, but those 5 are the most common ones. It will come up in your exam, but it will also be something you will see in real life every single time. Okay, so engage at your workplace. Ask questions, get involved with what's going on. Yeah, you're going to be a newly qualified pharmacist soon, and there's going to be loads of advice I'm going to give you. Remember, when you pass this exam, I'm going to be meeting up with you guys in Nando's, and I normally ask Bhavna, she came to the last one, and I literally pour my heart out, give her loads of advice from my 10-year experience as a pharmacist. I also come up with a document where I've added more things to what I gave them last year, as I'm having different experiences. I include things. Those are my personal experiences I've put together all in one place, and I give you as a special gift to everyone who comes to see us at Nando's when you pass the exam. So there's loads. Also, you need to ensure that you start some of the post-registration training. So we're looking at things like flu jab, vaccination, for example. It depends on the company you work for. Some companies, you've already done it. Yeah, some people, they've already paid for you to do the training and first aid training, for example. But you get loads of chance to do that even when you get on the register. You can do loads of training on CPPE as a trainee pharmacist if you want, or maybe once you get on the register as well. Okay, so there's loads of training for you to do, and you'll be able to do some of them now if you have the time or afterwards. Now we're going to go to education, which is where I'm going to invite Bhavna and Jazz to come in. And this education, I would say, obviously is the most important part, isn't it? Because if you don't pass the exam, then how are you going to get on the register? But in my opinion, it's not just about passing the exam, it's about being a confident pharmacist. I want all LPN members to be confident people, confident pharmacists, in the sense that you're not scared to walk into a pharmacy. You're not scared to go to a job interview because you know your stuff. You don't have to be perfect. You don't have to be, someone who knows the BNF back to back. No one knows the BNF back to back, but you know your basics, your fundamentals, you're competent. I'm not scared to go anywhere. I can literally go to Manchester, go to any pharmacy and work there, because I know my basics, I know my fundamentals. And don't worry if you make a mistake. None of us can do this job if we are worried about making a mistake. It comes with the territory, okay? But what happens is, from those mistakes, you're going to be a lot better. You will learn, and you probably wouldn't make those same mistakes again because you've already made them. Does that make sense? So I don't want you to beat yourself up and say, oh, I've made a mistake, or I'm doing my calculations on my clinical and I'm not getting 80% or 90%. Don't beat yourself up. Keep learning. Yes, it's a learning process. Just keep pushing, keep learning, keep pushing, and you'll get to where you want to get to. Okay, Rome wasn't built in a day. Okay, let's go to Bhavna. Bhavna, please tell us a little bit about yourself and what you're doing right now as a newly qualified pharmacist.
Thank you, Micah. Can you hear me okay?
Yes.
Thank you.
Mute temporarily, and I'm going to let you back.
Thank you. Hi everyone, my name is Bhavna, and I am newly qualified. It's been 7 months. I can't believe I was trying to recollect, and yeah, it is. It has been 7 months. So I qualified in June 2025 in the first attempt. So when I qualified, obviously it takes time to find the job. So I started with the locuming as a community pharmacist. But then currently I'm working. I have actually explored quite a few areas in these last 6 7 months, to be very honest with you. Currently, I'm working as a remote PCN pharmacist. So I do remote work from home. Um, and I do odd locum shifts here and there in the community. But I also am now joining as a face to face Band 7 PCN pharmacist in a couple of months' time. And I was very, very fortunate. I also had one induction as a bank pharmacist role as a detainee center, which is more like a prison setting, and that was a very different experience for me. So yeah, I'm just exploring, and I'm here today to share the tips that we maybe used in the exam, and maybe that will help you to prepare better. Thank you. I've got question here. Where did you do FDY? Yeah, my foundation year training was in the community pharmacy, and I had only 1 week experience in the hospital. So those who are in the community, please do not feel that you have missed out on something a lot. You guys are very lucky, and as far as I understand, you have the mixed foundation training this year, right? Because I had pre-regis who had community GP and a hospital. So, but we only had community. So don't feel that you're missing out. You will get, experience of everything. Whatever you have, just utilize. You can still do a lot of things, even being in the community. Community pharmacies are a very, very key point. So yeah.
Thank you, Bhavna. I'm going to go to Jazz. Yes, so Jazz, introduce yourself. Tell us what you're doing at the moment as a newly qualified pharmacist.
Thank you, Micah. So, hi guys, I'm Jazz, and I am based within Huddersfield. I went to Huddersfield University, as I mentioned earlier. I qualified now. I was on the register January 1st of this year, so I'm very newly qualified, 2 months in, and I had my foundation training year within Cohen's Chemist. I was based within community. I did have some experience within GP as well. At the moment, I am a locum as well, like Bhavna said, who also started off as locuming. It's really good, guys. Like, honestly, I really highly recommend you start off with the locuming. You pick up a lot of new skills. You interact with so many different staff members, different patients. You'll be in busy pharmacies, quiet pharmacies, and the range of skills you can really learn does help you for that first initial part of being qualified. At the moment, I'm also in the process of having a GP job as well. So that's currently in the process, and hopefully I'll be a mixture of both community and GP. Like Micah said, I sat the exam in June. Unfortunately, I did miss out on a couple marks for the calculations exam, but I'm hoping that my experience and my journey will benefit you guys of how I learned from June to passing in November. And as Micah says, smashing them calculations. Honestly, guys, I'm more than happy to help. And yeah, I'm hoping one piece of advice that we can provide for you today helps you between now and the exam in June. So yeah, thank you.
Thank you. Thank you so much, Jazz. That was fantastic. Okay, so you've heard from Bhavna. Bhavna sat the exam in June, and Jazz sat the exam in June. She was with a different provider. We're not going to mention any names. And she obviously joined LPN, and we revised. I remember speaking to Jazz and some friends. We revised for the November exam, and she passed. So it's fantastic to have her on here, like I said, because she'll be able to give you two separate perspectives: the June exam and the November exam. Okay, so I'm just going to ask Bhavna. Bhavna, so when did you start preparing? You start the exam in June. Did you start preparing 6 months before, 3 months before, 8 months before? When did you start preparing, and how did you prepare for your GPHC assessment before you passed in June? Yes.
Thank you, Micah. So, to be very honest with you, I had started from the day one. Okay. So we had regular study time at, I was very, very fortunate and I had a fantastic tutor. Me and Kripa, we had the same tutor and we had a regular study time, 1 hour every single day. If you're getting it, well and good. If you're not getting it, don't worry about it. You will just learn to make time. Now, I forgot to tell you that I'm a OSPAP student, so I have family commitments as well, but I still managed. So every single day, that 1 hour we used to study, but properly for the, and calculation is something that I always said to all my colleagues, is start from the day one, start doing at least 5 calculations every single day. Consistency is very, very important. GPHC exam is not something that you can prepare overnight. It has to, you have to slowly build up. So prepare from the day one, do 5 calculations every day. Now you guys have your 3 months in for the exam. So obviously now it's a good time to just focus. If you haven't made your notes, if you haven't actually started, it's still not too late. So we actually started with the practice questions, practice papers in April first week. Yeah, we started in April first week. We started with the question papers. So we had the list of 20 question papers that Micah gave us. And that was 20 for clinical, 20 for calculations. And I am a group learner. So I studied a lot in the group. And I had girls' gang. So it was 4 of us who studied together. So every single day we would agree that what paper we're going to do. And then we initially we were doing different papers, but then we were finding it difficult. Everyone was on a different page. So we started doing the same paper on the same day. You could do clinical first, calculation later. It's up to you. But then the best part was, because the way we were doing it, if we had any questions and the questions that we were getting wrong, it was easier for us to discuss because we all had done the same paper. So just follow Micah's list. For my training, I actually purely use LPN combo course. I had pro pharmacists provided from the work, so I did attend their trainings as well. But LPN was my go-to point. So attended his every single session live, and that does help. Calculations, Micah's a legend. You cannot beat Micah in calculations. So if you're just following what he's saying, just you will be in a safe hands. Micah has homework help club. I'm not sure if you still have Micah. We had homework help club, and that was optional, but we were still very greedy and we still joined the homework help club as well. So we used to do the homework sheet every single week. And then when it's his feedback session, sometimes we used to be on the bus and the train and just jump in with our headphones on and listen to the calculations. So just active participation. Even when you're in the live sessions, if you don't understand anything, ask question. No question is a silly question. And get the basics right. If you want to smash the clinical exam or a calculation exam, your basics have to be clear. You cannot by heart everything. If your basics are clear, you can apply the logics. So if you know which one is an enzyme inducer and which one is an enzyme inhibitor, you can actually apply that and you will find it super easy. So ask the question, why? Why is this the answer? So in that sense, I think when we did the group studies, we really benefited from that. What else? So yeah, we did all the question papers, and then Micah's recordings. I used to listen to Micah's recordings. When I'm cooking, I had his recording on. And I'm not gonna lie, Micah, live sessions, we go slow. So when I was listening to recording, I would speed it up times 2.5. I would pause wherever I need to. If I haven't, got that right, I would pause, I would re-listen, and I did that. But unfortunately, I found this thing, I thought of this recording part quite late, listening to the recording. Had I known it or had I thought of it earlier, I would have done even better. But it wasn't still late. In the last 1 month, I think I listened to every single recording that we had on your Google Docs. So if you are on Micah's combo course, please utilize that. His questions are amazing. Just finish all his question papers that he's giving you. Follow all his maths homework worksheets. Maths, Micah goes through very, very clearly, calculations step by step. Every single calculation questions, get into the habit of doing it as a timed question. I used to set the timer. And every single day I was doing 5 questions from the day one. But the days that I didn't do 5 questions, you have these trainees, lots of groups, you have lots of questions. They go around, oh, how can somebody help? Make sure you attempt those questions, because if somebody else has found that difficult, very likely that you may struggle as well. So do those questions, because those give you a variety. You're not doing just one topic by topic. When you're doing the questions that float around in the groups, you're getting more variety of the questions. So I did that as well. I think I spoke a lot. I didn't leave anything for Jazz. One last thing, I shouldn't miss it. Mike has mock test. He is the only one, as far as I know, who does the mock test, and he invigilates them right there, sitting in front of you, watching the camera, and you have to have a camera on. I think that was a real tester session for us, for the GPHC exam, because we were so like, you do go into the panic mode and you make silly mistakes when you know somebody's watching you. But I think because we had those practice runs done, we had those mocks done, I think I was quite okay for the actual exams. So thank you, Micah. You're a legend.
Bhavna, thank you so much. I really appreciate everything you said about us. But I think for the people that are watching you now, it's fantastic to be able to hear someone who has done exactly what they're doing and they've come out the other side. One of the things you said is that you're an OSPAP student, and we also have loads of MFAM students, and we also have loads of OSPAP students as well. And the thing is, some people have children. Some people have families, they have a husband, or they have a wife, or they have other things going on. You know what I'm talking about. You have to juggle all of these things, as well as your foundation year, being able to pass the exam, and it can be a lot. But the fact that you've done it and you've managed to come through it, pass with all the things you've said so far, it's amazing. Last year for the November exam, the oldest person on the LPN course was 56. We had a 56-year-old
Oh, wow.
on the LPN course, and he
Wow.
smashed the exam. Was a
I
man,
thought I was the
nothing to
oldest
say.
in
So,
my cohort,
and
but
he
I
smashed.
wasn't.
and he smashed the exam. So you have a 56-year-old who has gone back to uni, done his MFAM course, done his foundation year, sat the GPHC exam, passed it. And then you have, people that are 23, 24, no wife, no husband, no kids. And I say, oh, it's so difficult. I can't pass. Yes, you can pass. Trust me, you can pass. Honestly, if your 56-year-old is a legend, you can also be a legend. Trust me. So thank you for your contribution. Let me go to Jazz. So Jazz is an MFAM student. She went to Huddersfield Uni. And you sat the exam in June, and you also sat the exam in November. Jazz, because Bhavna obviously said some things already, what I would like to ask you is, how did you revise in November that is different to how you prepared for June? Like, what are some of the changes you made? What are some of the things that you did extra, or maybe the things you didn't do for the June preparation that you did in the November that helped you pass?
Yeah, thank you. So I'd start off by saying my main change, and I'm not just saying that because I'm on the call today, but honestly, guys, joining LPN transformed my calculations. When I'm telling you now, from the June exam and reflecting on the June exam, my confidence in calculations honestly changed so much. The jump in my score, the way in which I could answer the questions and the methods just flowed, the type of ways Micah provides you to answer the question saves you time as well. I noticed that from the June exam, at the end of sitting the calculations, I was rushing my answers. And if I could emphasize one thing, guys, is read that question for the calculations and read it again. There are ways that the GPHC can be sneaky with their questions, and they might ask for a daily dose or just one dose. They need to check your rounding, whether that's during the question or at the end. Most definitely, reading that question is what cost me not passing in June. And like I said, it was only 2 marks. So the first thing was joining LPN. I didn't really have a resource or a way in which I had a provider for the first exam. So having it for the November really helped. sit as many exam papers as you can, as many mocks. You can create a list. I'll show you guys here. I created a list with all the marks. So Micah tells you to write out the exam paper that you do, note the mark, and it's able to show your progress. You can identify your weak spots. And what I think is really good to do, guys, that I learned was a key difference from June to November, is if there was a calculations topic, let's start with dilutions, and I wasn't too confident on it, I would sit for an hour and just do solid questions for dilutions. And with the amount of resources that LPN has, there are a range of ways in which they ask questions for one topic. So that when I went into the exam in November, I was familiar with the ways in which they asked because I'd covered so many questions that I was confident going into the exam. Another thing that I really recommend for calculations is with your group of friends. If you share to one another the questions you get wrong, you're able to see the type of questions that they share, that you share, and you'll see questions that you might not have seen before, and you'll learn methods from your friends that will help you for the exam as well. All the mock papers that you do, sit in time conditions and be strict. Don't have a break halfway and think, that was a lot, I need to have a break. Do it in 2 hours, and it really will help you and ease yourself with the pressure for the real exam. In terms of clinical, I think that what helped me for November is speaking it aloud. Now, for me, my method might only help me. It might not help you guys, but what I would say is just give it a go. Speak out loud, speak the guidelines out loud. And another key thing is acronyms. You might look at the BNF and be overwhelmed with how much information is in the BNF, but honestly, acronyms will help you so much. So honestly, guys, yeah, my main change was sitting more papers. I've joined LPN and I sat as many different questions for the different topics that they can ask. But if I could say one thing that I want you to take away from today is read the question and read it again for calculations. But yeah, for me, I was more prepared. My speed and accuracy for the calculations improved. But yeah, my main difference was the way in which I revised for calculations. Yeah, that was my key change around. Yeah.
Thank you so much, Jazz. Okay, so yes, like I said, I spoke to Jazz and some of her friends just before the November exam, and one of the things she said was about reading questions again. Now, the year before last year, so in 2024, I had a lady, so literally her husband found us online on Instagram or something. So he managed to get my number. He called me and he said the wife is such in a state she couldn't speak to me. The wife is a trainee pharmacist, couldn't speak to me. So the husband spoke to me, and the husband was literally saying that the wife has sat the exam 2 times and she failed the exam twice. So she literally just got her result. I think it was the day before she got the results, and she's just devastated because she feels like she does all her revision properly, and she feels like she's smart enough, she's good enough to pass the exam, but she doesn't understand why she kept failing the exam. She started the first one failed because of calculations, started the second one failed because of calculations. So when I eventually, the lady kind of eventually spoke to her and I sent her some work she did, send it back to me. It turns out that this lady was making so many silly mistakes in her calculations that she didn't realize herself. And this is a problem a lot of people have. So they, do their clinical or do their calculations, and there's loads of mistake in the actual work, but they don't realize it themselves. So they're doing all these things, or maybe during like timed conditions or supervised conditions, the anxiety sets in, the panic sets in. And so as she's doing the work, she's making loads and loads and loads and loads of mistakes. So she'll sit the exam thinking she's passed it, but then afterwards she hasn't passed it. So what I've recommended for all LPM members who are struggling with their attention to detail is a problem some people have. And it's just like, it's not dyslexia. Obviously, there's dyslexia, there's dyscalculia, there's all these different learning conditions. But some people naturally don't have the same attention to detail as everyone else. And if you're that type of person, it doesn't mean you fail the exam. It just means you need to improve your attention to detail. You need to get some of the workbooks or past papers, print off what you can print off, take screenshots if you have to take screenshots, print them off, and then highlight questions as you're doing them. Highlight questions as you're doing them, because if you don't do that, you might end up missing information where it says someone is 5 kg and they take medicine 3 times a day. You might miss out the 3 times a day. You see, and it's some of those little errors that are making people fail. So reading that question and again and again and again, and putting yourself through, supervision would definitely help you, especially if you're somebody who is sitting this exam the second time or the third time. Another thing Jazz didn't mention was that Jazz actually joined some private group tutorials that we did, right? So when I spoke to her and we wanted to improve her scores, I said, do you know what? Before the exam, I normally organize some private group tutorials on Zoom where, we do extra practice for people who need the help. It's not mandatory. You don't have to join it. But if you've sat the exam before and you want to improve, or you're struggling, you want to improve, or you need like more supervision, where we do all our work in front of the camera, everyone puts on their camera, we work through it. You make your mistakes, but you correct them, and you build your confidence that way. You go through the process, right? So this year, that private group tutorials, I'm going to email you guys, but we're going to be starting a bit early this year. We're starting in April rather than May. For anybody who needs the extra help, you don't have to join it, but if you need the extra help, that's one of the things she did that's also helped her pass the November exam. We have some questions, guys. Let me highlight some of the questions. I'll go to Bhavna to answer a couple, and I'll go to Jazz to answer a couple. So let me highlight a question. Okay, so somebody is asking about clinical. Let's see. Oh, actually, let's go to this one first. Vicky, right? So Bhavna, this one is for you. Vicky says, how did you manage your family with study and exam preparation? How did you manage to juggle? At this stage, yeah, it comes with the territory. If you're a mature student and you have to do this, you have to be dedicated, and you just have to try and make it work. So let's hear from you, Bhavna. How did you manage to juggle studying, family, your training year, and so on?
That's a very good question, Vicky. Thank you. And I'm sure a lot of you are in the same boat as me. It wasn't easy, but you cannot do this without your family support. But again, I was working full time, doing in the community pharmacy, the busy one, 16,000 items. You come home, do cooking, and then you sit down. And hence why, if it wasn't for my group learning, I would have struggled. I'm not saying I would have failed, but I would have struggled, because it was, we kept each other motivated and we kept each other awake. That was the main thing, because we finish everything, you sit down 8:30, 9 o'clock, we had our sessions planned, and we would study every single day. We had our Zoom session, team session. We would do 9 to 11. So you have to lot of sacrifices when it comes to your family time, Vicky. But if you're in a group, then it still makes easier, because the girls I had were OSPAP girls, and they were in the same situation as me. There was another colleague who had a very young daughter as well. So sometimes she used to be in the shower, giving her shower, and then listening to what we were talking. I'm talking about Raman, Micah, because Raman has a very young one. So obviously that's how we used to, she was putting them to sleep, but she had headphones on. So sometimes she would not turn the camera on, or she would have a dark room just with her. We could see her on her laptop lights. That's it. It's the dedication and commitment. What I personally say, look, you are going to put the efforts, right? Then maybe just give you 200% and get it done in the one attempt. If I could do it, I went back to studies after 23 years. I mean, no doubt I was working in a pharmacy field, worked as a dispenser, then a tech, and then a pharmacist. So I had some experience. However, if you are going to work hard, then just give your best shot. But yeah, group learning is a fantastic way of learning if that works for you. I couldn't have done without one. And we still discuss a lot of things anyway in day-to-day practice. One more thing, I saw one question, Micah, that I would actually like to answer, if that's okay.
Go ahead. Yes. Which question is that?
There was one question: how did you prepare for your clinical exams?
Yes. Yeah, go ahead.
So there is one thing I actually forgot to share, one tip. So for the clinical, as I said, I had Micah's combo course. So I attended every single session with Micah. When he was talking, and I have a habit, I'm a pen and a paper person. As you can see, I still have my diary and a pen with me. So I like to make notes. So whenever somebody's saying something, I quickly jot it down. So, and that's how I remember. I cannot just listen and then recollect. So I made notes for every single topic that Micah taught us. And then when I was going over again, after the listening to the recording, I was adding to it actually more. And when we were doing the group studies, we were going through those same notes, and then we had those, because we all were with Micah, we had the same notes in front of us on our Google Docs. So it was easy for us to just discuss with each other. But then one thing I did separately, and we all started doing, and I helped somebody, I shared this tip with somebody who had failed June exam. Whenever you're getting anything wrong, when you're doing your mock papers, whenever you're getting anything wrong, find out that what went wrong. And I used to put it down in a diary like this. And a simple example would be prednisolone dose. When would you actually taper down the prednisolone dose? In which situations? So there are about 5-6 criteria. So then I would put it down in that diary. So I actually built my own dictionary kind of a thing with all the points that I was constantly getting wrong. So I knew where I was lacking, and that actually helped me to then go back, revise that topic further. So do your topics first, then do Micah's question bank, and then do the mocks. No point in just jumping straight onto the mocks without revising your topics, because then you're going to just put yourself down and you're going to feel that you haven't done your best. And don't aim for anything less than 80%. Just get that in your head. Less than 80% is not a pass. I won't say it's a fail, but just say it's not a pass. If you do get 78%, just ask yourself that where you went wrong. So for the clinical, that was making your own notes and making your own diary kind of a thing, just jotting down the points. I think that really, really helped.
If it's okay and you don't mind me just adding to your points,
Yeah.
I really do agree with Bhavna with all the points she's mentioned. And another thing I think that is really good for you to do, I know it's a lot when you're at pre-reg all day and you're working constantly 9 till 6, Monday to Friday, but sometimes you might come home and think you need a break, you haven't got that energy to revise. So throughout the day, when you're dispensing prescriptions, or say, for example, you're carrying out a pharmacy first, let's go for nitrofurantoin. Recall the points that you've learned from Micah, from your BNF, from your revision, and think, okay, nitrofurantoin, what colour does urine turn? What's the dose for males? How many days? And key things like that. Is it with food? Is it without food? That's all revision. And that's all beneficial because these questions will be asked in the exam, all your high risk drugs. And that's another good thing, because it's active recall as well throughout the day. So you are revising if you do need a break when you get home, because I know it can be overwhelming revising as well as working. So I definitely recommend that as well.
Thank you, Jazz. We have a couple of questions. Can you hear me?
Yes.
Yeah. Okay. We have a couple of questions. The first question I want to ask you is about mental health, right? So one thing a lot of people don't discuss openly during the foundation year is mental health, and how to balance the stress of going to work, a lot of cases 96, 97, and also being able to revise and deal with everything else that's obviously happening in your personal life, because just because you're getting ready for the GPHC exam doesn't mean you don't have a personal life to deal with.
Yes.
Some people have health challenges, some people have personal issues, and so on and so forth. And then some people are also dealing with challenges in their training site as well. You must have had issues at training sites with supervisors, with members of staff, and that type of thing. But generally speaking, how did you manage to look after your mental health during the foundation year to reduce the risk of burnout, just to reduce the risk of just crashing out completely? Do you have any advice for people that are watching us tonight?
Yeah, definitely. I can understand how overwhelming and hard it can be. And it is difficult from going from working all day to coming home and revising. But honestly, what I'd say, guys, for me personally, what got me through, because seeing my results in June, it was a shame. I was gutted at first, but for me, it was, what's my goal? I want to be that best pharmacist that I can be. There's a reason for why I'm to resit it. For the first few weeks, I did lack with my revision. I just took a few weeks out to have a mental break. I do think that for me, I thought, okay, where to start? I created a timetable. And I know you might hear that often, creating a plan, but visualizing and seeing what am I doing on this day? What am I doing on this day? It really does help you put your mind at ease because you've got it all written out and you know that everything will be covered. I do think that you guys deserve breaks, whether you guys think that, say, for example, you're revising one topic and then you're about to go on to your next. I do advise you not to jump from topic to topic, calculation to calculation, because your mind will be boggled because there's so much information for you to retain. So I do think that one thing that helped me was having that break. Whether you guys like to pray, listen to a song, watch a TV program, go for a walk, please have your breaks, because when I tell you, you feel refreshed going back to your clinical topic and you feel at ease and you feel so much calmer than overwhelming yourself with so many different topics. You go back and you feel fresh and you can look at your work and you feel focused with going in to a new topic. And try not to think about things that you've learnt before and think, oh no, I forgot this, I forgot this. Just go one topic at a time. And speaking with your friends as well is very key as well. That helped me because there were a few of us and we were all in the same position. And having my friends' support as well and my family support is really, it's good to speak out loud, speak how you're feeling. I do think that revising with your friends as well does help. Each night we would have a little clinical quiz, and sometimes my friends would send NHS skin conditions onto the group chat, and we would just have quick fire. It was fun as well. It made revision fun, speaking with my friends, and we kept saying we're going to be them pharmacists in Jan 2026. And I think speaking it aloud, words have power. So if you keep speaking it aloud that you are going to be the pharmacist and the best you can be, it really does help. But honestly, guys, I know it's a lot of pressure, but just stay calm, stay focused, and you guys will be fine. Have your breaks. That's key for sure.
Jazz, there's one last question for you. Alicia says, this question is for Jazz. Did you have second thoughts or felt like, oh my gosh, am I doing it right this time, and just being doubtful? So I think she's referring to, having sat the exam before and sitting the exam again the second time. And, did you have any doubts or worries when you were revising for the second time?
I did at first. I thought, because in the first time I sat it, I did come out thinking I'd done enough. And I did say this to Mika as well. I thought I had passed. But then having reflected and having sat, basically, guys, if you sit a lot of calculations questions, your confidence will really improve. And I think for me, there were times when I thought, am I doing this right? But having discussed it and being part of this provider and seeing how other students were and my scores, especially if I saw the progress. So my doubts, they started to vanish because I saw that my scores were going up and up and up. And because of that, I knew that I was on the right path. I made the changes, but I most definitely did have them doubts at the start. But then seeing my marks and constantly keeping up with mocks, I saw that there was a difference. And yeah, they eventually disappeared. And I definitely knew I was on the right track. And I think that if you guys write your results down and you see them and you visualize, you'll definitely see that you're making improvements. But yeah, I did have them doubts, but overall, I was all right eventually.
Thank you. So I'll just take two more questions before I say the final thing that I need to say. We have a question from Laura. I'm not sure which Laura. Is this Laura Hines from Ireland? Laura, if this is you from Ireland, please type 1 in the comment section. I have a question from Laura. Laura, I'm going to get Bhavna to answer this question. So Laura is asking, so how many hours study did you do every day, 3 months before the exam, if you can remember, Bhavna? Roughly speaking, the thing about you, Bhavna, you did do your foundation year training, so you had to work as well at the same time. But yeah, just in your experience, how many hours did you do of studying?
I was actually just typing answer to that question anyway. So I was when I was at work, obviously we had 1 hour at work, and then at night we would do at least 2 hours every single day. So it would be 9 to 11. And then as we came closer to exam, we started doing longer sessions. So at least 2 to 3 hours per day. Okay. That includes both your clinical as well as calculations. Nearer the exam time, I took 3 weeks off the before the exam. Micah always recommends do take 3 weeks, and I personally do say please take 3 weeks. 4 weeks can get a bit too much, and 2 weeks can get too little. I think 3 weeks is a right balance for you, because when you're at home, you're mentally relieved, you're not working. So that's one less stress, and you can spend time in doing your clinicals and calculations. And I think Jazz mentioned, and that's what I did as well, make a list of whichever papers you're doing. So if you've done Brighton, then make a note which clinical you did today, with the date, which paper, and what was your score. And you will be surprised that as you go further and further, your scores will improve. So that will be one motivation in itself for you to do better and better, because you will feel you've noticed difference. So yeah, when I was off for 3 weeks, we did one clinical paper, one calculation paper, did one discussion, and we still had our like 2 hours at night, 3 hours at night revising for some topic or whatever we got wrong during the day from the questions. If that helps, guys. But it will
Yes.
completely differ from person to person. Somebody might be doing, but I personally don't say that study 16 hours, because you're just going to overwhelm yourself, and um, you will not be able to give your best. So yeah, do take breaks and do look after yourself.
One last question for both of you, actually. I'll get Jazz to answer, and then I'll get Bhavna to answer before we conclude. Okay, so this question is from Obasi Presh. Jazz, he's asking, was the actual exam harder than the mock papers you did? Would you say the actual exam was harder than the mock papers? What is your opinion on this?
So I know, because I used to ask this question a lot. I used to ask it to previous students. In terms of, is it harder for clinical? I'd say I only did a certain amount of clinical papers, but overall, I didn't think it was harder than the mocks. I thought it was similar. And I do think one point, don't overthink the question in the clinical paper. Usually the first time when you see the answer, it's the right one. Don't start to doubt yourself. And in terms of calculations, I'd say that, yes, there are certain universities that provide calculations papers out there that are harder than the exam. But for me, Mika's exam papers and his mocks were the most familiar to both exams, having reflected on June and November. Key thing, watch Mika's predictions video. They honestly, hands down, one of the best resources and videos I'd watched. And there were some topics actually that I wasn't even aware of for June that Mika provided that came up in that exam. And I completed all of Mika's mocks, all of his test papers, and they were the most familiar to the exam for me. And I do think that if you do them, you'll be absolutely fine. Don't deep too much. Is this provider or is this university harder than the mock? If you can comfortably pass all them with 70%, 80%, and you can score high in Mika's, you will be fine for that exam. For sure, you will be.
Thank you so much. Let me go to Bhavna. Bhavna, what's your take on this? Was the past papers different to the actual exam, in your opinion? What's your opinion?
So I couldn't agree more to Jazz. I completely agree totally to what she said. Micah's papers were the most similar ones, but none of the past papers would resemble GPHC exams. The past papers would just help you to get your concepts clear and apply your knowledge. But Micah's calculation paper, 100% definitely, even his clinical was very, very close. So if you are attempting Micah's all mocks, all his question papers, I think you're in a very, very good shape. It's just the practice, practice, practice over and over and over again. And you just need to be consistent. As I said, it's not overnight job. And you've still got 3 months, which you are still in a really good time. So it's still not late. So please just start practicing from today, and you're gonna be fine. And one thing I would say, I would add to it actually, the GPSC's own exam question paper, practice papers, they were slightly similar to actual exams. So make sure you attempt those. And as Jazz said, don't overwhelm yourself by going to too many providers and going just confusing yourself with too many mocks. Follow Micah's list. He knows what he says. He knows what's going to be asked in the exam. Even I remember, Micah, on the exam day, you had 5.5 minute audio. It's probably still sitting in my group chat for the June exam, and I listened to that audio sitting in that cafe while having my coffee and revising, and I was just listening to it, what he said, and every single thing you said actually did come in the exam, in the clinical exam. So yeah, my cost predictions are one of the very, very closest ones. um, I couldn't agree more. RPS mocks were quite difficult as well. If you are RPS member, do attempt RPS mocks. And if you have got any training provider from work, and if they're providing mocks, make sure you attempt those mocks as well. But otherwise, I wouldn't say buy this, buy this, buy. I personally didn't buy any. I only did my CAS mocks, and I had my performance mocks. That's it. And I did all the past papers that you recommended.
Fantastic. Guys, thank you so much. I'm just going to conclude by giving general advice to the people that are watching us tonight. Okay, so we have, Bhavna that's joined us tonight. She's contributed fantastically. We also have Jazz who has joined us, and she's contributed massively to what we're doing today. And I'm sure a lot of the things they've said to you will definitely help you. Now, just from a tutor's point of view, you can use these tips, for your own personal preparation for the exam. So what's happened is Bhavna was a OSPAP student. She has a family to deal with and everything else. But she's a highly motivated student, right? So as soon as she joined, you can see her on, the live chat, she's joining. On the tests, she's joining live tests, supervised mock exams, she's joining. She asks questions, she answers questions. She's a very active, a motivated person. Okay, so meaning if you basically follow those footsteps, you're going to be fine. If there are live sessions, join, ask questions, contribute. If there is homeworks, I was just speaking to the students about last homework, Bhavna, which is going to be for session 5. And, it feels like school, doesn't it? Because no one else is really doing this. I'm the only one who sets homeworks and get the students to send it back to me. And then one lady, well, she's 23-year-old, 2 years ago, she said, "Why are you making us do so much work? You're not my daddy." I was surprised when I saw that in the text. She was like, "Why are you making us do so much work?" I said, "Look, I understand other providers are not doing it, but this is my style to ensure I get the best." Like literally, if you go through this process, it'll be hard for me to believe that you didn't pass the exam. You see, so back to what I was saying, Bhavna joined all the things that we did. Homework, she's done it, submit her answers. Test, she would join. If she didn't get the pass mark, she's looking for how to improve. I spoke to her over the phone before the exam. We went over, missed pay. I don't know if you remember.
I remember.
Reception, all that kind of stuff. You see, so a highly motivated person. Okay, so you follow those same footsteps, you pass the exam first time. Now, Jazz is also very motivated, but what happened, in my opinion, just looking at her own profile, she didn't get the right support for her first attempt. So she's seeing the exam again in November, seeing the exam in June, and maybe some of the topics that were in the exam, she's never seen it before. She actually came close. She actually came close, but maybe she wasn't exposed to, the right type of support, the right type of guidance. And it also depends on, where you did your training, You see, so a lot of people are in the same situation where maybe they're working in a very busy pharmacy, or they may be on a program that is not giving them what they need, because everyone is a different person. So one program may work better for one person compared to the other one. Does that make sense? So a lot of programs are independent learning. You sit down, you make your notes, you do your question bank by yourself, you do your past papers by yourself. There is no supervision. You do it all by yourself. In our case, we have both, which is you do your work by yourself, but it's my job to supervise. I don't care if it's 300 people, 200, 400, I supervise every single one of them to give them the real exam live experience, you see. And that's where a lot of people are making mistakes. And then I also spoke to Jazz before the exam, and to improve her scores, we had to get her on the private tutorials. We did, a bit more work that way, more supervision that way, smash the exam, you see. So What I'm saying is you can learn from everyone's story. You can learn from everyone's journey, because now we're all sitting on the same side. Bhavna is eating with us at Nando's now. You see,
I'm coming. Don't forget to
so
invite me with this new batch as well. I'll
yes,
join.
yes, yes. I'm inviting
And
everybody
I'll bring
again.
again the cake.
We had a fantastic time last time. You also brought me a cake. I enjoyed the cake. I took
We
some home
celebrated.
to the kids. Yes, thank you so much, guys. Bhavna and Jazz, I'm really, really happy that you guys have joined in to share your experience tonight. And if you're someone who's getting ready for the exam, I've made videos on how you can pass calculations. Make sure you go over topic by topic. Most people just start doing past papers or just start doing quiz bank. The problem with that is we don't know where your struggle is. Is your struggle dilutions? Is your struggle displacement volumes? Or maybe certain types of questions within dilutions or certain types of questions within infusion rates? We don't know that, which is why it's best to do them separately first. Yes, it's like building a house. Do it all separately so that you can see what type of problems you have. Once you've done that, then you can use the quiz banks. Now on our new website, we have the quiz bank, which you can set your own time. You can also use some of the past papers that we have on there. You can set your own time traditionally with your watch, anyhow you want to do it, but you have to do the base first, the foundation first, and then you manage your time, work on your accuracy, manage your time. Join the live assessments, the live tests, the live mocks, discuss with friends. That's how you do it. You do it that way, you score 80% minimum. With the clinical, I've created a study guide for everyone that's on the LPN course this year. And so with the study guide, you'll be able to see the important topics for every chapter. Chapter 1 has important topics: celiac disease, PPIs, for example, originates, for example, pancreatin, for example. All these things are the things they're going to ask in the exam. So it's all in our study guides, which I've emailed out to all our members. The same thing for chapter 2. Stroke is very important. Heart failure is very important. Make sure you use the recent resources, by the way, because these things get changed all the time. Diabetes, heart failure, asthma, they all get updated all the time. Make sure you stay up to date. Don't use very old materials. So use the study guide to see the topics that are important for every chapter, and then use flashcards or notes, or if you're an audio learner, listen to videos. Like Bhavna said, you can put the video on your way to work. If you're on public transport, for example, or you're cooking, for example, you're doing a bit of cleaning, you can just listen and just pick up points. Even when you think you haven't got time, you can still learn something that can give you an extra 1 mark or 2 marks or 3 marks in the exam just by actively or even passively listening if you're busy. Does that make sense? So what type of learner are you? Visual learner? Audio learner? Do you like to make flashcards? Do you like to make notes? One size doesn't fit all. You have to figure out what works best for me. Don't copy what everyone else in the country is doing. What is going to work for you? So do that, and then join those live lessons to apply your knowledge. Someone was asking in the comment section, what is the difference between the past papers and the GPHC exam? In my opinion, the main difference between, and it's also on the GPHC framework for this year, the main difference is now they're expecting trainee pharmacists to apply their knowledge more, not just learning the basics. So you can learn all the side effects of metformin, you can learn the monitoring requirements for lithium, but in the exam, or a very good example would be somebody comes in and they present with stiff neck, they present with non-blanching rash, they present with high temperature, fever, for example, they present with photophobia. They then ask you, what do you think is going on with this patient? So these symptoms suggest this patient may have meningitis. There's a meningitis problem in the country at the moment. But rather than telling you meningitis or telling you cystitis or pylon, they expect you to figure out from these symptoms or this patient's test results or from this patient's electrolyte levels, this is what's going on. And that's the thing that's mainly different to the past papers as a teacher, just looking at the past papers. A lot of the past papers are not getting you to see as a clinician, clinician in terms of someone who works in a surgery or in a hospital. They're not up to that level, most of them. You see, and that's where the exam is moving to now. They want us to be able to see a patient and look, they have heart failure, they have diabetes, this is their renal function. For that reason, they can't take this medication because this medication is contraindicated if your EGFR is less than 30. They can't take this medication because it's contraindicated in heart failure, like pioglitazone. Those type of things. Like that's the level they want us to be at now. But I've got you covered, and I'm going to help you the very best I can so that we can have that meal at Nando's in July.
Micah, may I just add?
Yes.
Adding on to that, with the clinical exam, they're not there to catch you out. You are a day one pharmacist sitting that exam. You will come across questions in that exam where you think both answers seem appropriate. You might eliminate your answers, come to 2 answers and think, okay, but read the question, which is most appropriate for the scenario you're given. Look, have they got an allergy? Have they got another medical condition? You will come across, and this is just a warning now, you will see 2 answers and you think, okay, which one shall I go for? But there will be something in that question clearly for you to go for the right answer. So most definitely, remember, you are a day one pharmacist. They're not there to trick you for the clinical exam. Having sat it twice, I most definitely can give you that piece of advice.
Thank you. Jazz, they want you to write your TikTok handle and your Instagram handle. If you can just write it on so I can put it on the screen for people to see if they want to follow you on TikTok or Instagram. So just to add to that point, in the exam, make sure you choose the most, most appropriate, the most concerning, the most concerning, the most appropriate. What is the best advice? This is the thing that separates 2 options that are very close. When you're sitting the exam, the clinical paper, and most of the questions will say, what is the best advice you can give? What is the most appropriate advice you can give? What is the most concerning symptom the patient is presenting? Does that make sense? So if a patient has meningitis, like we've been saying, the most concerning symptoms will be things like photophobia, stiff neck, fever, right? Those type of things. Someone has sepsis, it will be anuria, which is reduced urination or lack of urination. You see, so always see if you can work out or pick out the most important things, the most crucial things, the most appropriate things. Okay, so that's what you're going to do. Jazz, have you written your handle?
Yes.
I can't see it.
It is just below Bavna's comment. I can re-type it in the group chat. Let me type this in. There you go. Can you see it now?
No. Oh yeah, I can. Yeah. Okay, fantastic. So this is you on TikTok, but you also have a page on Instagram. It's called Farm Snaps.
Yeah, Farm Snaps. You guys can add me. I'll be most definitely posting some more.
Okay, Farm Snaps. Okay.
Thank you, Michael.
All right. Yeah. So guys, follow Jasmine on TikTok. Also, you can also follow her page on Instagram, which is Farmer Snaps, as well. Okay. So please stay positive. Guys, trust me, loads of people, there's 60-something thousand pharmacists in the country. They've gone through the same journey and they've managed to succeed. So if they can do it, I promise you, you can also do it. Okay. Believe in yourself. I promise you, you'll be able to succeed. Just stay positive and keep working as hard as you can. Success is going to be yours. Thank you, Bhavna. Thank you, Jazz. Thank you so much. Guys, type legend in the comment section. Type legend, type legend, type legend, type legend in the comment section before you go. You're an absolute legend. Don't let anyone tell you otherwise. If other people can succeed, you can succeed. You can pass. You're a legend, like so many of us who have sat the exam and we've succeeded. Okay, so just stay positive. Hang in there. Success is going to be yours. Thank you, Bav. Now end this session now.
Thank you so
I
much.
hope to see you guys soon. Thank you, Jazz.
Thank you for having us, Micah. Thank you. And all the very best, everyone. I'm in Micah's LP and alumni group. If anybody needs any support, Micah, feel free to pass on my number. I'll be happy to help them out. No problem. But if I don't answer the call, if I don't reply straight away, but I would get back to you. So, yeah. But good luck. You guys can do it.
All the best, everybody. You'll be fine.
Yes,
Thank you,
guys.
Micah.
Yes, guys.
Bye.
Bye.
Tap the like button for me before you go. Tap the like button. Tap, 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 tap. See you next time. Bye-bye.